Let's level set a little bit. For people who aren't really familiar, let's start with what is autism?
Yeah, autism is a neurodevelopmental disorder. It's a lifelong disorder that has a range of severities. And basically, what you have are abnormal behavioral and social skills, difficulty communicating, and sometimes they're repetitive thoughts and actions. But there's a whole range on this spectrum from people that are highly functional, but maybe just a little bit peculiar to folks that really need almost full-time care.
How many people have it?
That's a really good question. Latest estimate is because it's a lifelong disease, somewhere between 3 and 5 million people in the U.S. Have autism.
Okay, so some people are concerned because it appears that autism is increasing in prevalence. Explain that, then I have a follow-up question for you. Is it increasing in prevalence?
I don't think anyone actually knows the real answer to this, but let me just say in 2006, the number of kids that were diagnosed with autism was about 1 in 100 or 110. It's now 1 in 31. So it looks like there's a threefold increase in the number of autism cases that are being diagnosed. That could be due to increased awareness, changing diagnostic criteria, and we really don't know for sure. And so that's one of the big questions in the field.
Okay, you're being very polite. And a lot of experts believe that when you add up all the things you just talked about, it's almost unbelievable that the number could jump that much without considering that things like Asperger's have been reclassified. The way we diagnose is reclassified. I know when I grew up, and that was a long time ago when I was 8 years old. I mean, let's be real, that was 50 years ago.
Yeah.
We all had kids in the classroom that now looking back, I can tell you that Dwayne, and I made up that name, likely was somewhere on the spectrum. So the numbers reported have grown, but is it believable that they've really grown that much?
Well, let me just say, I'm cautious. And
I know you are.
I am a very cautious scientist as well. But I'll just say it stretches credulity that there's been a threefold increase. I really think the majority of this is due to different diagnostic criteria and an increase in awareness.
Mm-hmm. So tell us about HHS Secretary Kennedy's announcement regarding the cause of autism yesterday.
Okay, I'm going to preface my comments again by saying science needs skeptics. Science needs people to push the boundaries. But I think that the whole process lacks some credibility because you can't announce in April, 1 month into your tenure as Secretary of Health and Human Services, that you will have a definitive answer for autism, what the causes are, in September of that year. No matter how much effort you put in, you're talking about a very complex population-based study that's actually been studied very, very thoroughly by highly dependable scientists for many, many decades. And the bottom line is there have been some studies that show that there may be a slight association with different environmental factors and different genetic factors with autism, but no single smoking gun, no single cause. And so that really was something that was shocking to hear.
So with that said, the secretary cited a study by Harvard, the dean actually at Harvard, in making that association between acetaminophen, the active ingredient in Tylenol, and autism. Tell us about that work. Is it definitive?
It's not definitive. So the type of study that was done is called a meta-analysis. Basically, they looked in the literature, read all of the studies that fell within a certain category that they had established ahead of time, and then summarized what the findings were. So meta-analyses are really difficult to do. There are very different ways to do it. And they did show a mild association with exposure to Tylenol in pregnant women for the kids. The problem is other studies in the past that have been more focused on a single population, when they actually started to unpeel some of the coexisting factors, did not determine that there was a link between Tylenol use and autism. In fact, they actually had what they call case control studies where they looked at SIBs whose mothers took Tylenol when they were pregnant and another SIB who didn't and could not see any difference in the prevalence of autism. And having said that, it's really important for our listeners to know just because there's an association between two facts doesn't mean that one causes the other. And there's what we call a confounding variable here. women that are pregnant, the only safe pain medicine that they can take and the only antipyretic or anti-fever drug that they can take is Tylenol. So perhaps fever is the cause and not the medication that people are taking to relieve the symptoms. And we know that fever can cause developmental disorders.
Good point.
Okay. So if, let's say that I'm pregnant and I'm in my second or third term and I have a really bad fever, like it's like 101, 102, and I watch this and I said, and I don't take Tylenol and I just, try to sweat it out. What could happen to my baby?
Yeah, a lot of things could happen. Fever, high fevers in pregnancy are associated, depending on the trimester, with developmental disorders, with neurocognitive defects, brain damage. There are a lot of different things that can happen. So fever in the mother is not benign for the kid, the fetus. So I would say it's fine to be reluctant to take medications. Absolutely. I think that was one of the good things that came out of the press conference, but not to overdo it. We need to be reasonable. So if a pregnant mother has a fever, they need to talk to their midwife or their physician and get advice about what to do.
Dr. John Raymond is with us. Dr. Raymond, we fear that as people who consume the news all the time, we know a lot more about all these stories than the average person because we have to, because we discuss it. You have to because it's in your industry. What about the mother who sees the headline on Facebook or on TikTok, doesn't see all the other stuff like what we're discussing, and sees the headline of the president literally saying, don't take Tylenol, has a fever, and is afraid? Can you talk about the damage when half information is put out there and people don't read the correction or the clarification?
Right. It's a legitimate concern. People nowadays are interested in consuming information, very small bites, and not really thinking very deeply. And one of the real issues that I have with how this has been handled is it almost feels like a media blitz. And I worry that there's going to be a deluge of social media posts amplifying and oversimplifying what they were trying to communicate yesterday during the press conference.
So there's also, what about folate and the recommendation to treat autism with, forgive me if I don't say this correctly, leucovorin?
Leucovorin. So leucovorin is used with chemotherapy to mitigate some of the side effects. Some chemotherapies lower folic acid or folate concentrations, and that mitigates it. So there is a very specific form of autism called cerebral folate deficiency, where there is a deficiency in the brain of folate that is treated with leucovorin. Leucovorin is a folate analog that's metabolized to folate. One of the problems here, and I want to make sure that we warn everyone listening, don't go take folate or folic acid. Don't give folate or folic acid to your child that has autism, because there are actually studies that show high levels of folate can cause autism or are associated with it. So there must be an optimal concentration of folate if, in fact, it is one of the causative effects that you need to achieve. So please don't self-medicate with folate.
Is it frustrating when you have people? Is it frustrating when you have people who don't have medical background talking about very important medical issues?
Yes, for the most part. But an informed public is great. Challenge your healthcare physicians with information. That's what they're there for. But please talk to and believe the people that have your best interest in mind. That is your doctor or your nurse practitioner or your physician assistant. They know you the best. They're there to be your advocate. And they are people that are trained to understand how to critically appraise the literature and to understand what's a good study and what's not such a good study.
All right. I didn't prep you for this ahead of time. Do you have good news of the week? Can you help us?
I do.
Okay, thank you.
I think I was very careful to say that medicine's not just about doctors. I mentioned midwives and nurse practitioners.
That's
and
true.
PAs.
You're right.
This is Advanced Practice Provider Week. So this is a week to celebrate physician assistants, advanced practice nurses, midwives, and other folks that help doctors as key members of the healthcare team. So if you have a PA or a nurse practitioner that you see, be nice to them this week.
I like that. That's very good advice. You make a great point.